Okay, so I'm going to talk about visualization of radiofrequency ablation lesions with iodine-enhanced cardiac DynaCT. Cardiac DynaCT is a rotational imaging tool using a fluoroscopic C-arm that rotates around the patient, and using gated images is able to create a three-dimensional image, and you were able to use that to generate images of the lesions that are created during RF ablation. One of the challenges with RF ablation is it's very difficult to characterize the lesion after it's delivered. We use a lot of surrogates to figure out the quality of the lesion, but we don't really know whether the lesion is transmural or not. In a lot of ablations, it matters to know this in terms of what the endpoint of the ablation is, and whether it's a substrate ablation or otherwise. Knowing that you have a high-quality lesion is worthwhile. Some of the current things that we use are RF energy delivered, how much energy we're putting in, the temperature at the catheter tip, change in the tissue impedance can be used, and also we can use things like pacing or electroanatomical mapping to determine whether we've delivered a lesion. However, real-time and direct assessment of the RF lesion size and volume may be a useful endpoint as well. So direct lesion has been done before. This has been done using different modalities such as MRI. Also, it's been looked at with different tissues other than the heart, and in addition, it's been looked at with ultrasound. MRI, for example, can assess where a lesion is and give some quantification of the lesion. However, the challenge with MRI is it's often done after the procedure as a separate procedure, and in some patients who have devices, they may not be able to have an MRI, at least in some institutions. So ideally, the scar tissue could be assessed, or the lesion could be assessed during the procedure. We're able to do this with 3D CT images that we can get in the cardiac cath lab. The C-arm here can move around, rotate at about 200 degrees around the patient, and in doing that, generate these three-dimensional images. It'll make 4 rotations over about 20 seconds while the patient's holding their breath, and gated to the cardiac cycle, and we can then recreate the images. In this study, we used 9 female swine weighing between 50 and 55 kilograms. We delivered 2 to 5 ablation lesions on the endocardial LV wall. We attempted 50 watts for 30 seconds, and we targeted temperatures to be achieved above 50 degrees. We then imaged the animals by placing a catheter in the inferior vena cava and injecting a volume of contrast, in this case 150 cc's of Omnipaque. And then we did multiple imaging runs at 0 minutes, 1 minute, and every 5 minutes for up to 25 minutes. These images, as I mentioned, are 4 sweeps around the animal, 5 seconds each, roughly ECG gated. And then we reconstructed them, typically during diastole, using ECG gating. Just to give you an idea of the iodine contrast kinetics, this is what a first pass image might show. And here, if you have a lesion, you can see the lesion is one of the areas that doesn't get enhanced with the contrast. As time goes on, the lesion develops an enhancing ring around it as well that may be edema or something like that. And we also took these lesions, once we finished, we sacrificed the animals and measured the lesions. We did histological measurements of the lesions in order to correlate this with the measurements that one can obtain using our C-arm system. This is just to show you also, we also looked at the intensity of the lesion in terms of the signal. Here's 0 minutes, for example. You can see a very intense lesion, and that intensity diminished with some time. And these are some of the examples. We created 29 lesions. All lesions we were able to visualize. 24 of these lesions, or 83%, had a peripheral enhancing ring around them. This is one example of the lesion here. You can clearly see that the lesion is visible very nicely. Blant-Altman statistics were used to look at the correlation between these lesions and between the histologically derived volumes, and they were very much within a very narrow band, indicating that regardless of the size, they generally were pretty accurately reflective of each other. Lesion area as well. And here, if you look at the first pass versus later on in the imaging cycle, you can see the differences in the images with the development of the enhancing ring as well. Image quality, there was some streak artifacts. However, overall, the image quality was quite good, and we were able to figure out some ways to improve image quality as well. So, to conclude, this was the first study to demonstrate, visualize, and characterize RF ablation lesions with ECG-gated C-arm-CT or DynaCT. Direct C-arm-CT visualization of RF lesions can determine the size and potentially the transmurality of the lesions. And it represents what we feel is the current state of the patient immediately after the procedure, and this information could potentially be merged into electroanatomical mapping systems. So there are some limitations. Obviously, these are acute lesions. These are not chronic lesions. Ability of some patients to undergo contrast injection may be a limitation. The use of ionizing radiation in addition to the procedure is a limitation. Possible need for repeat imaging. However, I think future developments in this technology may improve the amount of radiation used and may, in terms of reducing it, and may reduce the amount of contrast necessary as well. Hopefully will lead to some advantages. Some future work that's currently being looked at in our lab is looking at different myocardial models, for example, acute infarct model, hopefully soon a chronic infarct model as well, to try and characterize scar a little better, and this might be something that can be done at the time of the procedure. And we, of course, thank all the participants in this study, in particular our veterinary help and statistical analysis help. Thank you.